Uganda is transitioning newborn sickle cell screening from targeted sites to a nationwide mandatory program. That's what we are transitioning. And all of you are aware that we now have the RDTs for sickle cell screening produced locally within the country. So we need to take this advantage.
We need to advocate for sickle cell patients. We need to stand in for them. Because sickle cell patients, they die very early. Before 5 years, 90% have died. The few that progress to teenage years, again, a big bunch die at the age of 20. So there are very few adults or advocates who can then speak for sickle cell. So we, here together with the media, need to stand up for sickle cell patients and advocate for them and ensure that these patients are getting care.
Community should know what sickle cell is, not to just hear about it as a myth, as probably witchcraft. We should be able to know what it means to be a trait. A carrier should be able to know how to do a test. Just like as we capture children for zero-dose vaccination before they leave the facilities, we should also capture children to be able to know their status by the time they leave our facilities.
If every person knew their status, okay, if every person, especially before they decide to get married or to have children, then this will reduce the number of babies born with sickle cell disease.
With the launch of the locally manufactured testing kits, we have gone a long way in ensuring that capacity is built around the country. And thanks to the leadership at Ministry of Health, because all district lab focal persons have been trained on how to use the locally manufactured testing kits to diagnose the newborns.
We need to reach national, we need to impact the generations, but we need to be able to have the knowledge. So we really would want that we get this knowledge. We need to get what are the tools which work, and we need to be able to ensure that no child in Uganda suffers or dies from this disease unnecessarily. Thank you for listening.